Part two, what happens when we get into the hospital of idiocy where they've had all these issues and stuff like that before, right? So here we go. So basically, mom gets there. She's not breathing well. They end up intubating her, so she's sitting in the ER. And y'all know, no matter where you are in whatever part of the country, ERs are like the pits. You know what I'm saying? It can't get any better. I mean, you have every ER is tiny. They need more space. They got people on little gurneys with like shower curtains to block them from each other. People are coughing and sneezing and all types of stuff on each other. They're doing exams on people in the middle of the damn aisle with like a little box to block their whatever, you know, whatever you could think of could go on is going on. There's crazy people there that don't even really, let's say, need medical stuff. They need some psychiatric help, maybe not medical wise. You got other people there trying to get a little something to get them high. All kinds of stuff is going on there. And it's around flu season and so on and so forth. So basically, the place is packed. Mom ends up being in the ER for a few days. One doctor that I thought really made me laugh was he needed to do an exam. Now, any of y'all who deal with adults that may be incontinent or babies, we all know what Desitin and A&D is. This guy had no clue what it was, and he was intrigued on what it was that was on my mom. And this substance, this mysterious substance. And I told him, sir, that's Desitin. The nurse next to him starts laughing because she's probably changed a diaper once in her life. But anyway, mom stays in the ER with these kind of people. They think that Desitin is a gigantic mystery. It's a mysterious substance. It needs to be investigated. But anyway, mom goes from there to now they're saying she's going to go to the ICU. So now I'm actually a little happy because generally ICUs watch the patients a little bit better. It's a smaller room with more trained professionals. They're more on top of the patients and stuff like that. So in this aspect, mom would probably usually get better, right? It's usually between the ER and the regular floors where it gets janky and shit. So mom they transfer her, but they don't transfer her to like a regular ICU. They bring her to a regular floor, right? And regular ICUs, you're kind of like semi-isolated or isolated. You're either behind like a little curtain in a little small room, or you're in like a room with a glass door. You're not sharing a room with somebody else sick. Never mind somebody of another gender. But anyway, so they got mom in the room. The room's hot as whatever you could say. It's like 90 something degrees, which most hospitals are usually cold to kill the germs, but not this hospital. So mom ends up being in the room with this guy. You didn't really see doctors. You saw a whole lot of PAs. There was like a different PA for every day. So one day I come in, my mother's completely covered in ice. Reminiscent to when I was working in catering and we would get fish delivered, and the fish were just fresh fish covered in ice. So I come in, my mother's completely covered in ice. I asked the PA who was there that day, why is she covered in ice? Oh, sir, she was running a fever, so we had to cool it down. So I'm like, okay, well, that looks like an old way, like maybe like when they used to give you an ice bath back in the day to try to cool your body temperature down, right? Okay, I can't hate on it. Next day I come in, she's still got a fever, the room's hot as heck. And I go, I asked this different person there now, different PA, what happened to the ice? I mean, she still has a fever, right? We can't put ice on her. She has pneumonia. Well, she had pneumonia yesterday, so what's going on? What's different here? Your colleague covered her in ice. You don't want no ice. Nobody even wants to give her Tylenol. Mom's running a crazy fever. It was ridiculous, right? This is supposed to be an ICU, right? But it was like a regular floor ran by confused children, basically. The nurses didn't even wear PPE on this floor. It's supposed to be an ICU, so you figure people got all kinds of infections and stuff. You probably might want to wear PPE The rest of the hospital, they wearing PPE, but not on this 7th floor. So basically, mom's on this floor. They're all confused. They don't know what they're doing, you know. And then she starts getting random injuries, like her foot swells up because they gave her too much water and they weren't watching her properly, so the leg swells up. Then they wrap something around the leg, so all the water goes into the foot. Now she's got a big blister on her foot, right? They take her for an X-ray for something else, and then they find out that they done broke a hip, right? They broke mom's hip. You know, more than likely, you know, one of these people grabbing her to move her or something. You know, some of these ladies could be like the size of linebackers in hospitals and so on and so forth. And we all know if you're dealing with like older women, older men, babies, you got to be careful. You can't just grab them like you're grabbing some groceries, like, you know, you're lifting weights at the gym or something like that. So, but a lot of people, and a lot of these people are young and inexperienced, don't know what they're doing. So, and of course, they're not going to tell me who broke a leg, God forbid, right? Or how it happened. I mean, she comes in there with pneumonia, and now she's got a blister on her foot, a fracture in her hip, right? She spends a few weeks on this, you know, godforsaken floor, and nothing is getting any better. Things only look like they're getting worse. One night, her roommate, the guy, right, who was sick, as sick as her or maybe sicker, he's over there and his oxygen's going low. And I could literally see it from where I was sitting visiting my mother. So his oxygen's going lower and lower and lower and lower and lower until it hits like 40. It was like in the low 90s, then the 80s, then the 70s, then the 60s. Mind you, his alarm is ringing. This is supposed to be an ICU. There's supposed to be people around. There's supposed to be a respiratory therapist. There's supposed to be a doctor. I haven't seen a doctor the whole time my mom was on that floor. There's supposed to be a PA. There's supposed to be a nurse. But where are they? Who knows, right? They're all young, you know, Generation Z. They're probably in the lounge doing TikTok dances and shit. You know what I'm saying? But anyway, this poor guy, his oxygen goes down to like 40 something. He about to meet whoever he prayed to. You know, whoever he prays to, whoever he worships, whatever. Alarms are going off. Now the rest of the hospital has been got wind of this, and now you hear, please respond to room such and such, bed, blah blah blah. Then now all of a sudden, whoever should have been there all appear, and now they're all frantic because the dude almost died in their watch, right? And they're frantic. What are we gonna do? So then mom gets transferred because they said she caught a new infection, either from this poor guy that was sick. God knows what he had. You know, they did nothing to like separate them from each other. So he could have gave her something. She could have gave him something. I mean, it was ridiculous. None of the nurses are wearing masks, so they could have walked in another room where another patient was coughing, caught God knows what, and then bring it in and give it to mom and this guy. And they're not wearing no masks or nothing. I mean, you don't want to wear a mask in public, fine. But in an ICU, come on now. Basically, she gets transferred to the ICU, right? Mom gets transferred to the ICU. She's there. Again, it's a little bit better. The service is a little bit better, but it's still janky because they have majority like med students who are PAs running the show. And each one of them knows less than the other guy. You know, they'll make conflicting statements, you know, like, this medication your mother was on wouldn't do nothing at all, I tell you. And then 2 minutes later, I think that's why the thing happened on her foot. I'm like, so sure, medication that she hasn't been on in like damn near a month now, somehow it's still in her system because you said it was so weak that wouldn't even help her with a fresh dosage. But now, it's the possible reason. Like, come on, get out of here. You don't know what you're talking about. And thank God for my mother's doctor, uh, because she was intervening, basically giving me ideas to run past them about tests and certain medications and stuff that you should just be like regular knowledge. Like I would think about it, and definitely her doctor would think about it. But these, like, Doogie Howser without the talent guys had no clue what they were doing. Part 3, she gets out of the ICU.